I want to turn to your book now, and get your thoughts on that. And I want to start with an incredible story you tell at the beginning. You talk about how you and your parents immigrated to the U.S. from China in 1990 when you were 7 or 8 years old, and you came with just $40 to your name after paying the plane fare, visas. Can you talk a little bit about what your life was like in China and what brought your family to the U.S.?
Well, my parents came to the US, I think as many did, in order to pursue the American dream. My father was a political dissident. I come from a family of dissidents, and he was jailed in China for various political activities. My mother was able to come to the US first, and then my father and I followed. We initially lived in a little town in Utah, and then moved out to Los Angeles. And I think, just like so many other immigrants, my parents went through some very difficult times. They worked multiple jobs, but still had trouble making ends meet. And there were times that we depended on food stamps. There were times that we were in between different houses and shelters and even experienced homelessness. And I wrote about this in this book because even though I had initially intended Lifelines to be about my experience leading Baltimore's health department and the lessons that we learned in public health, I decided to tell my own story of immigration and growing up because, in so many ways, that's also a story of public health. That the public services that we needed were there for me and for my family when we needed it the most. And in fact, that's what helped me and my sister and this generation to be able to achieve our dreams. One of the stories I recount early in Lifelines, too, is about how I watched a neighbor's child who was just a couple of years younger than me die in front of me because his grandmother was too afraid to call for help for his health because she was afraid that the immigration authorities would come and that would result in the entire family being deported. You can imagine from an early age watching a child die, in this case from asthma, right in front of me, had such a profound impact on what I understood about our healthcare system, that healthcare in this country is not valued to be the right that it needs to be, and that our society treats people very differently depending on who they are and where they come from. So that very much drove my decision to enter medicine and specifically to become an emergency physician and work in the ER because I never wanted to be in the position where this is the pre-Affordable Care Act days. I never wanted to be in a position where I had to make a decision about turning someone away because they couldn't pay for their care or whether their documentation or immigration status allowed them to be treated.